Hey guys, it's Annabelle. For those of you who do not know, I am about to finish my fall semester of my sophomore year of nursing school. Today I'm going to be talking about how to succeed in nursing fundamentals. Now, this is the first official nursing class you will take in nursing school, and with that comes a lecture, a lab, and a clinical rotation. In your nursing fundamentals lecture, you are going to cover a lot of topics. Now, this is the foundation of nursing. You are going to fall back on all of these concepts and all of these units throughout every other rotation in nursing school. So it is very important that you truly understand what is being talked about and what you are learning, because again, this is basically your building block for your entire nursing school career. Now, obviously, if you made it to nursing fundamentals, you have passed anatomy and physiology. At least that's how it works at my school. I know some other schools may have you take anatomy and nursing fundamentals at the same time, depending on your program. But if you have taken anatomy and physiology in college, you know that there can be a lot of slides in one lecture, and that can be very overwhelming. So at least once you're in nursing fundamentals, you kind of already have the experience of having a lot of information thrown at you in a very short period of time. But in a lot of cases, there can actually be a lot more slides per lecture in nursing fundamentals and a lot more that you have to remember. So one thing I'm going to say is, if your professor is nice and decides to post the lecture slides before the class, I would say take time to at least read through the slides before you go to your lecture. This will help you at least see the information that is going to be talked about before it is talked about. But if you want to take it a step further, it's definitely important to take notes before you go to class. A lot of professors will just read off of the slides and that's it. But my professor would not just read off of the slides, she would also add in other supplemental information. She would add in stories from her own career, just to really add on to what is in the slides and add on to our knowledge, which is exactly why it is so important to take notes before you go to lecture. If you take notes on what is on the slides beforehand, you already know what is on the slides. You're already familiar with that information. That way, if and when your professor adds in other information, you can just focus on that and add that into your notes. The last thing you want is to be overwhelmed during lecture just trying to write everything down. By doing it this way, you're able to sit in lecture and just listen, and if there's anything you want to add into your notes, you can just add it. As far as studying goes, the best way to study for nursing fundamentals is practice questions. A lot of the information you're given are based on scenarios, and that's usually how your test questions are going to be as well. A lot of times, especially in the first few units of nursing fundamentals, they will give you many definitions of different things, and you have to apply those definitions to the scenarios. So nursing fundamentals, unlike anatomy, is less memorization and more applying your knowledge, which is exactly why yes, flashcards can help in certain units of nursing fundamentals, but practice questions are really going to help you be prepared for the exams. So as far as finding practice questions go, you can look up practice questions on Quizlet for the exact unit that you are learning. A lot of schools will also have separate applications that you can buy that have practice questions that go along with your book, which is what I use, and I really love those because they give you feedback as well. Not only does it give you a grade after a practice quiz, if you get an answer wrong on one of them, it will also explain why the correct answer is correct. You can also watch YouTube videos about the unit that you are learning. A lot of them will have practice questions embedded within. I know my professor didn't offer any review sessions, but if yours do, definitely go to review sessions. In most cases, your professor will go over only the information that will be on the exam. So if you have the opportunity to go to a review session, or say they upload one onto Canvas or Blackboard, whatever your school uses, at least watch it. It definitely helps. This is also a really great opportunity to ask questions about something you may be confused about. Even if you're just watching a recording of a review session, maybe another student will ask a question that you also have and you're able to get your answer. So for lab at my school, basically what we did is for fundamentals, we would have a 4-hour lab once a week, and within that 4-hour lab, the first 2 hours was skills lab, which is where we talked about the skills that we were going to be learning and we were shown how to do them, and at the end we were given a little bit of time to practice the skills, either on each other or on the mannequins. And then the last 2 hours of lab were either a sim lab or deliberative practice, and both of these would alternate every other week. So one week I would have skills lab and then sim lab, and the next week I would have skills lab and then deliberative practice. So starting with skills lab, again, this is where we would talk about the skills as well as start practicing them. At least for fundamentals, if you are already a nurse assistant, you're not going to really have to worry the first couple of weeks because it's going to be basic skills such as making a hospital bed, transferring a patient, vital signs. But if you aren't already a nurse assistant and those are things that you are struggling with, or if you are a nurse assistant and you're struggling with any of those skills or any of the more nurse related skills that you learn later in the semester, go to open lab if it is offered. This is a great time period to go into your lab and practice any skills that you're having any issues with, or if you have any questions about a skill, or say you have skills sign-offs coming up and you just want a chance to practice it before you are evaluated. In SimLab, this is when you will be doing a simulation. I know in my sim, there was only 6 of us, so 4 of us would go at a time to do a simulation. Our instructor would leave the room, and she would be watching us through a camera and talking through a microphone, which was on the mannequin. We'd be given a scenario, and we would each be given a role for that scenario. One of our sims, one of us was the recorder, so they would record all of the information that the nurse was collecting as well as the nurse assistant was collecting, and then the 4th role was a family member. In other sims we did, there was no recorder, so it was just 3 of us playing the nurse, the family member, and the nurse assistant. This is definitely intimidating, and I feel like I'm always going to have anxiety before SimLab, but in order to prepare for them, you're usually going to get an assignment that is due beforehand, and you'll usually go over it before you do the sim. One of our assignments, we had to research about 9 or 10 medication, and that was because it was going to be a part of our simulation. One thing I want to say is, although simulation can be very scary and it can definitely cause a lot of anxiety, that is the best place to make mistakes. I mean, think about it. You're with a mannequin. You can't hurt a mannequin. You're not with a real human being that you could genuinely cause harm to. So if you mess something up, if you give the wrong dose, if you maybe forget to lift the head of the bed when you're giving oral medications, that is the place to do it. And think about it, once you mess up in SimLab, you're always going to remember to raise the head of the bed when you're giving oral medications. Say you stick yourself with a needle, you're always going to remember to be extra precautious when you are dealing with needles. And then in deliberative practice, this is where we got signed off on our skills. So we would have a packet with all of the steps to each skill, and on a certain day, we would get signed off on a certain number of skills. This obviously can be intimidating as well, and unfortunately, a lot of the skills you can't just practice at home or can't just practice on somebody you know, such as injections or catheters. But again, Open Lab is the perfect place to go and prepare before skill sign-offs. In most cases for nursing fundamentals, you are going to be placed in a nursing home for your clinical rotation, and this is because you are doing mainly nurse assistant skills. I know the first day of my clinical, my instructor just told us to answer call bells, go make friends, go talk with the residents, learn about them. We did a scavenger hunt to see where everything was on the unit. We also had an assignment where we had to pick a patient chart and find certain information. As some weeks go by, you will start doing some of the skills that you learned in lab at clinical, such as bed baths, transferring, definitely making beds. If you don't have anything to do, find a bed to go make. Look busy. Even if there's nothing to do, look busy. Go in and ask residents if they need anything. 99% of the time they do, and they just won't press their call bell. And in all of those cases, it's usually something so simple, such as just needing a glass of water, or maybe they have a question about something. Also, I know this is a lot easier said than done, but don't be afraid to answer call bells. If you ever have a question about something, or if you're ever unsure of something, just go ask. I know it can be intimidating to go ask any of the nurses, or even the nurse assistants, or your instructor. I got really lucky with my instructor. She was the most amazing person ever. She was incredibly helpful, and she genuinely wanted us to succeed. But I do know that in a lot of cases, clinical instructors are not always the nicest. Again, if you're ever unsure, it's better to just go ask rather than do something that could be harmful. I know, at least for this rotation, there wasn't always a lot to do, but even if you are not given an assignment to do, go do something. That will make you look so good. It'll make you look confident, even if you're not. And at the end of the day, the staff of wherever you are placed is going to be extremely appreciative. So say you're only given one patient assignment for that clinical day, go and do care on another patient. Go and do care on 3 other patients. helps out everybody, and it just makes the day overall a lot less stressful. It makes things go by a lot faster, and it's giving you more experience. Another thing I want to mention about clinical is treat every day like a job interview. And I say this for every rotation. Even if you never think you are going to work there, you can use these places as references. So if you are the person that sits in the corner with their feet up, playing on their phone, no place is going to want to hire you. You're going to be that exact way as a nurse. Even if you say, oh, I'm just going to be this way at clinicals, no. That's just the kind of person you are. Get up, go do assignments, even if you're not told to. You shouldn't have to be told to go do something that you are fully capable of doing. If you see a call bell on, go answer it. Don't sleep on the couch that is in the back room. There was somebody from my school in a different clinical group that would sleep the entire clinical day. I don't know how she never got in trouble, but just don't be that person. At the end of the day, you're not only representing your school, but you're also representing yourself. So just make a good impression and don't do anything that you would regret, unless it's a mistake. Don't regret any mistakes. Mistakes happen, you learn from them, own up to them. It's not the end of the world. So that is how to succeed in nursing fundamentals. I wish you all the best of luck if you are just about to start nursing fundamentals, or if you are currently in the middle of it. It's definitely overwhelming at first, but it's not impossible to do really well. So with that being said, that is all I have for you today. Don't forget to subscribe for more content like this. I post content related to nursing school, reading, lifestyle, and little vlogs. I hope you all have a wonderful day. Bye!